One, two, three, four, five, six. This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Senior Corporate Communications Officer at the Ministry of Health, Al Alexander.
Good morning to our listeners and viewers on the various media platforms. Welcome to the Ministry of Health's virtual media conference for Monday, 17th May 2021, where we provide you with current and accurate information on the Ministry's COVID-19 response. Today in studio, we have the Honorable Terence Dial Singh, Minister of Health, the Honorable Faris Al-Rawi, Attorney General and Minister of Legal Affairs, Dr. Roshan Parasram, Chief Medical Officer, and Dr. Miriam Richards, Principal Medical Officer, Institutions. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's media conference. We begin with the CMO, who will present the clinical update and speak about the national vaccination plan as it pertains to the Sinopharm vaccines.
Hi, good morning. Honorable Ministers, Dr. Richards, members of the media, members of the viewing and listening public. So we'll begin as usual with the clinical update for 16th of May 2021. So the total number of tests done in the public and private facilities, 153,053. Over the last 24 hours, we would have reported 356 new cases, taking our total up to 16,255. Our total recovered patients now stand at 10,208. The active cases are 5,762, and those in hospital are now at 382. Dr. Richards will expand on that particular category. In terms of number of deaths, we had 9 deaths over the last 24 hours, taking our total up to 285, and condolences again to the families of those individuals. We have 111 persons that stepped down, and in the quarantine sites, 381. Total vaccinated persons with their first dose stand at 60,671, and those of second dose, fully vaccinated individuals, 1,179. If I could have my first slide, what I'll be discussing this morning is as you know, the vaccine developed by the China National Biotech Group, known commonly as Sinopharm, has been given WHO, EUA, EUL. I'll be going through, as it's customary, the stipulations from WHO, the SAGE group, that actually has lent itself for that EUA, EUL classification. So if I could have the next slide. So manufactured by the Beijing Institute of Biological Products Company Limited, vaccine referred to as COVID-19 vaccine, also known as BBIBP, coronavirus. Vaccine platform is an older platform. So it's an inactivated virus, meaning that it's an actual viral particle of COVID-19 that has been deactivated to an extent that it can't cause the virus to be present in an individual, but it causes an immune response. So 57 jurisdictions have granted EUA on their own, and over 65 million doses administered through the emergency use platforms. Next slide. So the intended use are persons over 18 years, and this is from WHO. Persons aged over 60 years is separated. And so what we are in Trinidad is looking at doing it very similar to AstraZeneca, meaning that anyone over the age of 18 can have this vaccine. Those with comorbidities can do so as well. Those with persons living with HIV and immunocompromised. Although WHO has granted EUA, EUL for pregnant and lactating women, at this time, Trinidad is holding on that particular subgroup. We will have deliberations through the TAG group and through the Director of Women's Health in the coming weeks to determine how we move forward, but for now, we are holding on that subgroup. Next slide. So again, it is stored at 2 to 8 degrees Celsius. It is given in a 2-dose regime, 0.5 mils, given into the deltoid muscle preferentially, as you see in the picture depicted. Next slide. So again, we look at the timing of the doses. So timing of the doses between the first and the second dose for this particular vaccine is 3 to 4 weeks, which is much less than the AstraZeneca, which is 8 to 12 weeks. And it gives you that sort of rapid turnover of the population going from a first to second dose in a very short period of time, which is very good by way of going towards herd immunity and getting mass vaccination. Next slide. Again, vaccine efficacy is approximately 79%, 78.1% against symptomatic SARS-CoV infection 14 or more days after the second dose. So we have to be mindful that if you have one dose of either this vaccine or the other vaccine, one doesn't give you the optimal effect, and two, you can still get COVID-19 and spread that virus to other people. So we have to continue following the public health guidelines. Even after the second dose, what it does is it protects significantly from severe disease, but you can be infected and you can spread it to others. So we have to always be mindful of continuing that public health guidelines, masking and all the others. Vaccine efficacy against hospitalization, 79%, and evaluation against the variants of concern, and at least according to WHO, hasn't been done significantly. There's some literature that suggests that there was a little decrease in the effect for the South African variant, but the other variants it hasn't been evaluated against. Next slide. So again, just to note, the vaccines, which are BIBP and COVID-19 vaccine, Wuhan vaccine are two different vaccines. So there are two different Sinopharm products, which were the Sinopharm vaccine out of Beijing was granted WHO EUL, and not the vaccine out of the Wuhan plant, although they're the same product. So we are using the one that has been granted EUA. Again, 5 jurisdictions using it, including Bahrain, Bolivia, China, UAE, and Seychelles. It is also has EUA, as I said before, in 52 jurisdictions, including in Dominica and Guyana. Next slide. What is EUA? And we use this term EUA and EUL. So EUL is a key tool used by the WHO in assessing vaccines, therapeutics, in vitro diagnostics in order to expedite their availability during a public health emergency. EUA is a tool used by health regulators in different countries to speedily release a vaccine for use in the event of an emergency like a pandemic. So EUA is more the regulatory arm of it. Next slide. And this final slide, I think, is just giving a list of the vaccines that have been granted EUL status by WHO and the dates. So on the left, you're looking at Pfizer-BioNTech, which is known as the Comirnaty mRNA platform, given on the 31st of December 2020. AstraZeneca from SK Bio on the 15th of February 2021. Astra from the SII Institute, 15th of February 2021. Janssen-Cilag, Johnson & Johnson, single dose, approved 12th of March. AstraZeneca from another plant, given on the 16th of April, which is, I think, the Italian plant. Moderna mRNA on the 30th of April. And last, Sinopharm Beijing Institute of Biologics on the 7th of May. I believe that is my last slide, and back to you, Al.
We do apologize for that. Thank you very much, Dr. Parashram. We will now have an update on the parallel health system by Dr. Miriam Richards.
Good morning to the Honorable Minister of Health, the Honorable Attorney General, our Chief Medical Officer, Dr. Roshan Parasram, members of the media, the viewing and listening population of Trinidad and Tobago. Thank you once again for joining us at this morning's press conference as we provide up-to-date information regarding the status of the Ministry of Health's response to the COVID-19 pandemic. Thank you very much, everyone, for your patience as we had a slight technical glitch this morning. This morning, I will be focusing on the hospitals in the parallel healthcare system, which of course we have noted have had an increasing number of admissions over the last 3 weeks or so. So this morning I'll start by just a rough discussion of what the rolling average is, and at present and up until yesterday evening, the rolling average continues to increase, and that is the number of confirmed cases of COVID-19 on a daily basis over the last 7 days. That number is approximately 414, and this is important to note because the greater the number of confirmed cases of COVID-19, the greater the number of persons who require medical care at a hospital within the parallel healthcare system. The number of admissions and discharges continues to increase at a consistent rate over the last 3 days, and it's important to note this trend of an increasing rate. We have noted, based on the last week, that the number of confirmed cases that require admission in a hospital is in the vicinity of 18 per 100, while we have a discharge rate of 7 per 100. This means that for every 100 cases that have been confirmed, 11 persons are required to go into hospital and stay there. That means that on average we are seeing an approximate number of 40 additional patients per day, and with that focus on Trinidad and Tobago, with each passing day in terms of the increasing numbers at the hospital. We continue to see a gap, that is, admissions continue to exceed the number of discharges, and the Ministry of Health has been trying to promote the resilience of the parallel healthcare system by adding beds incrementally and adding more spaces for our ill COVID-19 patients. Over the weekend, the UTT Valsayn campus step-down site added another 10 beds. So the capacity has now increased from 40 to 50 beds. We hope to add another 10 beds by this evening, so we go up again by 60 beds. What I'd like to remind the population is that as we continue to add beds, they continue to be filled. So there continues to be a backlog and an excess number of patients that require care. Every one of us and every citizen, every national deserves a good quality of care. And if we continue at this rate, we are soon going to run out of spaces at the hospital. And when I speak of spaces, yet again, a bed is not a bed, just a bed, and we will run out of the support systems, the nurses, the doctors, the ventilators, the lab services, and the ambulance services, which continue to be understrained by these increasing number of cases. At the ministry, we continue to do our part by engaging all possible to increase those spaces for good care for COVID-19 patients, but you need to do your part by adhering to the prevention measures and basically staying inside and preventing mixing unless absolutely necessary. So please stay inside. That's the way you can decrease the the demand for beds, while we marginally have been increasing supply on our end. If we continue at this rate, we will compromise the care of patients in the traditional health system, which means that a pregnant mother may not get a bed. An ill child may not get the ambulance care if they have some medical condition. The overall ward occupancy in Trinidad and Tobago continues to increase and is currently at 75% as of this morning. And the overall Trinidad and Tobago occupancy is at 67%. Of course, we look at the red flagged percentage of 75%. Our HDUs are at maximum capacity, and we continue to try to convert beds, to add nursing staff, but of course, these resources are starting to run out and have begun to run out. The ICU capacity is at 100% in Trinidad and Tobago and 97% overall. Again, a challenge there. Just a quick breakdown of our hospital occupancy levels, because the type of care depends on the hospital that you are admitted to. The Cora Hospital this morning is at 86% occupancy. The Augustus Long Hospital this morning is at 92%. The Arima General Hospital at 77%. The Couva Medical and Multi-Training Facility, which is our most ill patients, at 70%. St. Anne's at 100%, and Tobago at 32%. Our step-down centers continue to be filled. UTT is currently at 100%, Daybay 74%, Point Fortin 40%, and expected to increase this afternoon. So we continue to see our hospitals being filled as quickly as persons are discharged, persons are being admitted, because there are persons in the accident and emergency wards awaiting admissions. In closing, I would like to remind members of the population that we are indeed a civic-minded and responsible people, and we have to do our part in decreasing this trend. We have to continue to adhere and to comply with the COVID-19 prevention measures. That is, please wear your mask. Let's watch our distance. Let's continue to social distance. Let's self-isolate properly when we are quarantined as a primary contact or as a COVID-positive patient at home. And let's wash our hands and continue to sanitize. We are all hopeful that if these measures are complied with and we follow them, we will soon be able to flatten this curve and return to some normalcy very much in the near future. Thank you very much, everyone, and please be safe.
Thank you very much, Dr. Richards. I now hand you over to the Honorable Terence Dialsing, Minister of Health.
Thank you very much, Al. Good morning to my colleague, the Attorney General and Minister of Legal Affairs. Good morning to the Chief Medical Officer, Dr. Mariam Richards, ladies and gentlemen of the media, and members of the viewing and listening public, wherever you are. I just want to encapsulate everything that Dr. Richards. I don't know. Sorry, so we seem to be having. Am I being heard? Yes. I just want to encapsulate everything that Dr. Richards just said in an old saying which we old-timers grew up with, not the Attorney General. And that is, an ounce of prevention is better than a pound of cure. If we try to prevent ourselves from becoming infected, we will do the healthcare system a great good. I want to start off this morning by once again thanking all our healthcare workers for the wonderful work they continue to do. They are stressed, they are tired, but they come out every morning to take care of the sick and comfort the dying. I am always amazed that when we need more space and we think we can't find any more space, we seem to find space. But as Dr. Richards constantly says, this is not the solution. We need to get people to stop congregating and stop infecting themselves. Ladies and gentlemen, I am here this morning to handle the issue of vaccine procurement because there's a lot of misinformation. There's a lot of information which is good, but there's a lot of bad information, whether it's deliberate disinformation or misinformation, whether it is innocently spread or deliberately spread. So I want to bring some clarity on where we are. especially as it relates to Pfizer and Sinopharm and the role of the Honorable Prime Minister. It is unfortunate that the narrative continues to be that Trinidad and Tobago has been tardy in procuring vaccines, even though the evidence shows otherwise. The Honorable Prime Minister, as Prime Minister of Trinidad and Tobago and as Chair of CARICOM, has always been out front advocating not only for Trinidad and Tobago, but for the region, for poor countries to have equitable access to vaccines. He has always been doing that, and he has always led the diplomatic efforts to get vaccines for Trinidad and Tobago. Due to his advocacy, the Honorable Prime Minister, through diplomatic efforts, has been able to secure 140,000 doses of vaccines for the people of Trinidad and Tobago. 40,000 AstraZeneca, after he wrote to his counterpart, the Honorable Narendra Modi, Prime Minister of India. And then his conversation with his counterpart, the President of China, on May the 15th or May the 16th. Those 100,000 doses of Sinopharm vaccines should arrive in the country tomorrow night. There's an unfortunate narrative that the Prime Minister should have been talking to Pfizer and talking to this one. I want to put on record that Trinidad and Tobago has always been engaged with 3 initiatives. 1, COVAX. 2, the African Medicines Council platform, which is being managed through CARICOM, and also through bilateral talks. The continuing narrative about the involvement of the private sector, which continues to be pushed, is unfortunate. No private sector company, and we keep saying it, but it keeps popping up. No vaccine manufacturer anywhere in the world at this point in time is talking to, negotiating with any private sector organization in Trinidad and Tobago, and I dare say in CARICOM and possibly the rest of the world. So I am hoping this bit of misinformation and disinformation is clarified. Another commentator is on record in one of the news broadcasts is that we have stopped the vaccine program and we are holding vaccines and not giving it to people. So the science is this. We have vaccinated 60,000 persons with their first dose of AstraZeneca vaccine. The reason why we stopped is that we are holding back another 60,000 so those persons can get their second dose, so they could be fully immunized. We have to appreciate that we are doing all that we can, and in some cases much better than others. Some of our commentators, and I really hate doing this example, but it is in the news, the Asia Pacific news, like to point to Singapore, and Singapore is a very good country. They have very good metrics and many things that we should emulate. I just want to read an article from the Asia Pacific News of May the 16th. But the speed of Singapore's inoculation program is being limited by the pace of vaccine supply arrivals. Experts are studying whether to give 1 dose of the vaccine and extend the interval between shots. We are not there. The world is facing a vaccine supply problem. And you would have heard nobody other than Dr. Tedros asking the United States not to and to suspend their vaccination program of children in the United States and make vaccines available for poor countries around the world. That is the state of play with vaccine supply. I now want to reiterate again the efforts of our bilateral talks. With Sinopharm, we began bilateral talks on October the 1st, 2020. We signed a non-disclosure agreement on March the 15th. Now, some persons take this non-disclosure agreement and use it selectively to say, why only Sinopharm? We also signed a non-disclosure agreement with Pfizer, but they would not tell you that, and I have said so publicly. A non-disclosure agreement is not because the government has something to hide. It is the precursor to a heads of agreement and then a sales contract. A non-disclosure agreement has built into its features that the party like Trinidad and Tobago cannot disclose anything to do with patent rights, formulation, and pricing and quantities ordered at this time. In the fullness of time, pricing and quantities will be made available. But if Trinidad and Tobago breaks that non-disclosure agreement, it jeopardizes the acquisition of vaccines for Trinidad and Tobago. So it's not that we have anything to hide. It is normal, maybe the AG can lend his support here. It's a normal negotiating process when you are dealing with something that is very new and the companies want to protect their intellectual property. So we did that with Sinopharm on March the 15th. I can tell you that talks are progressing very well with Sinopharm for the procurement of commercial quantities in the hundreds of thousands to do mass vaccination programs in Trinidad and Tobago to achieve herd immunity. So the Ministry of Health has been leading that charge, not the Prime Minister. The Prime Minister leads the diplomatic efforts which have paid rich dividends. As to the call by someone to say the Prime Minister should be talking to Pfizer, if we do that, we jeopardize the acquisition of vaccines. Let me again put on record how proactive we have been with Pfizer. We started formal discussions in December of 2020. We signed another non-disclosure agreement on January 19th. Look at the date, January 19th. So our talks progressed from initial talks to a very important step, a non-disclosure agreement, and I have explained what that is. January 19th, 2021. We now have EUL, Emergency Use Authorization, which Pfizer got, I believe, on January 31st. So understand the timelines. We have been talking with them since December, and I just want to put in the public domain. It is not when we want to talk to these companies, it is when they are willing to talk to us. Because at this point in time, every vaccine manufacturer holds the ace. We have been making all efforts to talk to them, but it's when they want to talk to you. We have had discussions up to March 9th and April 29th. The current position after April 29th of Pfizer is that they will be sending to us a heads of terms agreement. That heads of terms agreement is a general document which is a precursor to a sales contract. And then the sales contract will talk about pricing and quantities. I know there's a lot of information about Pfizer out there. I cannot account for other countries dealing with Pfizer. I have accounted to you for what the Ministry of Health has been doing with Pfizer since December 2020. I bring this information to you because there are those who wish to derail the country's vaccination program and will do anything in their power to muddy the waters, the negotiation waters with Sinopharm and Pfizer. So I am hoping that the public conversation could be one based on fact and one based on truth. Because you see, ladies and gentlemen of the media and members of the public who are listening, to do otherwise will be to derail this country's vaccination program, as some people want. There is no other country in the CARICOM that has this level of bacchanal over the acquisition of vaccines. Political opponents in other CARICOM countries put aside their political differences and work and negotiate in best faith for what is best for their population. I am urging all commentators to be reasonable in their comments and let their comments be based on fact and be based on truth. So, ladies and gentlemen, there is where we are. Let me just recap briefly. There is no agreement at this point in time for any vaccine manufacturer to enter into talks with any private sector entity. I want you to understand that in May, vaccine supply is still being outstripped by demand. One of the main reasons is because of what is happening in India and Serum Institute of India, which was supposed to be the main vaccine provider to the COVAX facility. They now can't even produce for their own country, and our heart should really go out to our brothers and sisters in India. I can tell you now, with our current state of affairs, I know exactly how they feel. So we are doing everything possible through diplomatic channels led by the Honorable Prime Minister, with able assistance from my colleague, the Minister of Foreign and CARICOM Affairs, Dr. Amory Brown. He must be lauded for his diplomatic efforts. We have been dealing strenuously with the COVAX facility. To date, that has brought in 66 or 67,000 doses of vaccines. On the diplomatic front, 140,000 doses. And we are getting closer every day between Sinopharm and Pfizer to bring in commercial quantities. But I just want to urge us all, don't say or do anything in the public domain that will derail those bilateral arrangements. That is what I have to talk about this morning, and I want to thank you for allowing me the past few minutes.
Thank you very much, Minister. I now invite the Honorable Faris Al-Rawi to update us on the latest public health regulations.
Good morning to my colleague, the Minister of Health, to the CMO, and to Dr. Richards, and to Mr. Alexander. Good morning to the people of Trinidad and Tobago. I'm taking this opportunity to address the circumstances of not only the public health regulations, but also the state of emergency regulations. Trinidad and Tobago is in a state of emergency. The state of emergency was exercised by virtue of a proclamation of the President of the Republic of Trinidad and Tobago. Section 8 of the Constitution, Section 8(1)(b) specifically, allows the President to specifically call a state of emergency where there's an occurrence of, in this case here, an infectious disease. As we know, the COVID-19 virus was declared in January 2020 to be a dangerous infectious disease under the Public Health Ordinance. Specifically, standing as an infectious disease, the President has been invited and has accepted and has proclaimed the state of emergency in Trinidad and Tobago. The Honorable Prime Minister gave notice to the population on Saturday gone that the process of triggering a state of emergency would be given, and that the Office of the Attorney General would issue regulations in due course. Trinidad and Tobago is accustomed to dealing with the public health regulations. As a government, in January of 2020, we were faced with the advent of COVID. And by March 2020, there were 3 options open to the government to treat with the COVID pandemic. The first option was to declare a state of emergency. The second option was to use the dangerous disaster measure provisions. And the third option was to use the public health ordinance. The government elected to use the public health ordinance and managed the pandemic by virtue of regulations. That course of action was a very successful course of action, and as the Prime Minister has repeatedly informed and explained, the election of the public health regulations was specifically because Trinidad and Tobago, by its government, was not being taken into the suspension of rights under the Constitution, which a state of emergency allows. In these circumstances, therefore, the Prime Minister explained to the nation on Saturday that the time had arrived as a result of the situation of the COVID measures and also the population's reaction to it or lack of compliance, and with the complying situation resulting in numbers of infections, albeit with a significant increase in testing, the Prime Minister informed the population that we would move to the state of emergency. Therefore, at present, there are 2 regimes that are operating in Trinidad and Tobago. Firstly, the state of emergency by virtue of the regulations which guide that state of emergency. And secondly, the public health regulations. There is, of course, the body of laws of Trinidad and Tobago, both the written laws and the common laws, meaning the unwritten laws, that guide the Trinidad and Tobago Police Service in how crimes and other situations are to be managed. So the population, in first principle, is invited to understand that we are now in a state of emergency. The proclamation has been made. Regulations have been issued. We have the management of the COVID pandemic under the state of emergency regulations as it relates specifically to the issue of who can be outside or inside during normal working hours, which is 5 a.m. to 9 p.m., and at the application of the curfew at 9 p.m. straight to 5 a.m., who may be permitted to be outside. The second limb is the pandemic management via the public health regulations, and the third limb is the general laws of Trinidad and Tobago. In the COVID management via the public health regulations, you will note that the regulations as published yesterday and became effective yesterday, those regulations still manage mask wearing, the enforcement with fixed penalty notices, etc., the obligation to report COVID positives, the quarantine provisions, the testing labs. Those are still parked in the public health regulations. In the state of emergency regulations, there is a full description of the state of emergency, in that who is permitted to be during non-curfew hours, that is daylight hours till 9 p.m. Essential businesses are to operate. The state of emergency therefore says, if you are a described essential service in Regulation 3, you are permitted to be out and about during the daylight hours. If you can work at home, you are invited under the regulations to work at home. The regulations set that out in Regulation 3, daylight hours. Regulation 4 sets out the curfew parameters. The curfew parameters are described in detail. The presence outside is generally banned except for certain circumstances. There is the overriding understanding and requirement that the Commissioner of Police issues permission to be out, or other bodies that are given that similar power. And the description in respect of energy services, for example, manufacturing services, example, all of those fall under the general supervision of not only the Trinidad and Tobago Police Service, but the Trinidad and Tobago Defense Force. Under the state of emergency, the TTDF can be called by the Commissioner of Police to provide assistance, and very specifically, they have, under law, the powers of the police. So put quite simply, the police service and the Trinidad and Tobago Defense Force will be out and about during the state of emergency. They both carry police powers. The obligation to explain your circumstances, why you are outside during daylight hours, and also nighttime hours where a curfew applies, is upon every citizen of this country, and the Trinidad and Tobago Police and the Army can stop you, ask you questions, and ensure that they are satisfied that you are acting within the regulations. There was a very unfortunate headline in the Express newspaper, which says, "State of Emergency SOE stumble. Government late with giving legal effect to state of emergency curfew." I would just like to point out, most respectfully, to the editors of the Trinidad and Tobago Express, that these sorts of headlines don't help people tremendously. First of all, it's factually inaccurate to say that there is anything late in the issuance of the regulations. And I say that most respectfully because, number one, the Prime Minister alerted on Saturday that a state of emergency was requested to be triggered by the President in accordance with Section 8 of the Constitution, and that in fact was done. The Prime Minister also alerted the population that the regulations would be worked out and that in due course the Attorney General would issue those regulations. And I would like to point out that these regulations are very unique. We have had states of emergency in Trinidad and Tobago on several occasions. In 1970, in certainly the turbulent times there, persons who are a little bit older will recall those regulations. Secondly, we had the 1990 state of emergency. We had a 2008 state of emergency. We had a 2011 state of emergency. All of those states of emergency were focused upon crime and criminality, upsurgence, safety of the person as a result of criminal action. On this occasion, we have issued a state of emergency under Section 8(1)(b) of the Constitution for an infectious disease. We are therefore dealing with an enemy of a different type. And of course, everybody understands that that is quite simply the COVID virus, an unseen but deadly enemy that has no discretion and no discerning for geographic locations, circumstances of wealth or poverty, or any of those factors. And therefore, it is obviously a sensible equation that those regulations receive careful attention because they have to be carefully balanced. So I say most respectfully to the editors of the Express newspaper, let's try to be in assistance to issues as opposed to creating inaccuracies and distractions as to the real focus of the laws. The fact is that the regulations were issued yesterday. They are in proper stage and in effect. And these regulations, I would like to remind, may be issued from time to time. The Prime Minister has already indicated to the population that in this pandemic, measures are applied depending upon the population's reaction to the regulations. And obviously the CMO and his team and the Minister of Health advise on what steps are required in light of the pandemic. Therefore, it is open for stricter measures to be applied. Permit me to address now the issue of the rights of citizens under a state of emergency. The keen observer will note in the regulations that these regulations are not of the 1990 or 2011 type of state of emergency structures. These regulations are very heavily focused on public health issues and the management of those circumstances. I wish to caution that the regulations do permit the Trinidad and Tobago Police and the Trinidad and Tobago Defense Force, within the parameters of law, to engage in causing compliance in any place. That is both in public and in private. The focus is obviously on the public health side of the equation. Therefore, members of the population, citizens of Trinidad and Tobago, residents, visitors, you are obliged to be aware that there's a state of emergency and you need to comply with the law and comply with the lawful directions of the Trinidad and Tobago Police Service and also the Defense Force. You are also reminded that the public health regime with public health inspectors, quarantine provisions, breach of quarantine provisions, all of these also stand side by side in this process. Permit me now to address what happens in the way that we have to manage these laws, how they are extended, how they are approved. The Constitution is the source of authority for how we treat with the extension of the state of emergency. Quite simply, for those in the media who wish to report on this issue, I refer you to Section 7, 8, 9, 10, 11, and 12 of the Constitution. Specifically, the Constitution says that upon the proclamation of a state of emergency, which is a notice published by under the President's hand saying that there exists a state of emergency, and in this case for the reason of public health and infectious disease, that a statement must be issued by Her Excellency the President within 3 days of that proclamation. That proclamation came into effect at midnight on Saturday night, and therefore within 3 days a statement of the President has to be laid in the Parliament, in the House of Representatives, and that statement must be debated within 15 days of the declaration of the state of emergency. Section 10 of the Constitution clearly sets out that a state of emergency lasts for 15 days upon proclamation unless it is extended by way of a debate passed with a simple majority support in the Parliament. So the statement of the President must be debated within 15 days, and an extension of the state of emergency to allow for regulations to continue must also happen within 15 days. Those two are matters for the Parliament. It is a simple majority approach. After that happens, the regulations allow for the extension of the state of emergency up to a period of 6 months by simple majority measures in the House of Representatives only. The Constitution further provides that if there is to be a further extension of time for 3 months, beyond 6 months, that 3/5 of the House of Representatives and 3/5 of the Senate have to approve that further extension. So those are the milestones and goalposts involved in the state of emergency, how it is extended, how it provides for regulation and assistance. In summary, the population has the state of emergency regulations, the population has the public health regulations, the population has the other laws of Trinidad and Tobago, all of which must be observed. The population is invited to comply with the directions, the lawful directions of the Trinidad and Tobago Police Service and also the TTDF as they lend service and aid under the regulations and under the Constitution. The population is reminded that the regulations are quite clear, that they stand for public health management. As the report of compliance is measured, there is room for further stricter adjustment up to the point, God willing, where we'll be able to remove the regulations and migrate back to public health regulations only, perhaps. I note that one of the sensational issues on discussion platforms right now is the issue of exercise in the public domain. I would like to simply point out to the people of Trinidad and Tobago, do not be surprised. When one observes a mad rush of individuals, not in groups of 5, all congregating in areas such as Chagaramas, Lady Chancellor Hill, Palmies Park, San Fernando's areas that we enjoy, our steps, etc. One has to be conscious that it is the congregation of people that we are managing. And therefore, the advice that came to the government and which was accepted and introduced into the regulations, the expert medical advice is that we had to reduce circulation. Exercise is something that is particularly important for all of us. I can say as a person that is a heavy exerciser, if I don't get my daily dose of exercise, my endorphins drop and I tend towards depression. I want to get that physical training for clarity of mind. We all feel the same way. We can exercise at home. We can exercise in our yards. What we have to do is to be very sensible to join in assisting the fight against COVID. This is not intended to be an extenuated situation, an extended situation where we are just simply out to cause people trouble and difficulty. These are hard times. I'd like to remind, as I close, that when people refer us to other jurisdictions have lived under states of emergency which resemble what our public health regulations did. Other jurisdictions have existed under the watch of curfews, etc. Trinidad and Tobago, this is the first time that we are treating with a state of emergency for a pandemic purpose. Obviously, the limitations of the Constitution are clear. The extensions of states of emergency, etc., are very involved processes. We have now put to bed the issue of who can act, in what circumstances. The whole argument of private and public is with some better clarity under a state of emergency. These regulations are very carefully drafted, such as to preserve a balance of rights. We have achieved in these regulations a balance of rights. I will end by saying that the regulations are, of course, open to further restrictions and, of course, further modification. I'm quite confident that there'll be a number of questions coming from the media corps, and I thank you, Honorable Minister of Health, and to the members of this team for allowing me the opportunity to address these issues. Thank you very much.
And thank you, AG. We now move to our question and answer segment. In the usual fashion, I'm asking our media representatives to begin by stating your name and the name of the media house that you represent before you put forward your questions to our panelists. In order for us to get the most out of this segment, we ask that you just 2 questions per media house in the first instance, and of course, if time allows, we will take additional questions. We begin this morning question and answer segment with Loop TT.
Hi, good morning, everyone. Nika Parsanal here from Loop TT. Firstly, Attorney General, I'm sure you know there are a lot of questions regarding these regulations, particularly the bits on dwellings. So considering the difference between a private dwelling and private property, can you properly explain for us what exactly the parameters are during curfew hours? We have people worried that they can't be in their yards after 9 p.m. It also says that the Commissioner of Police can adjust the time for the curfew. Is it normal that he holds that sort of power in an SOE?
Thank you very much.
Yes.
AG?
Thank you for the question. So let's deal with what the law says, what the regulations provide. The Regulation 4 says specifically, subject to the exemptions, no person shall be outside of their private dwelling, including a motor vehicle, ship, or vessel during the hours of the curfew. Dwelling includes your precincts of your property. The reason that we use private dwelling is that a dwelling in Trinidad and Tobago can be anything from a shack to a mansion, to the use of a container, people who live in vehicles, for instance, etc. So therefore the concept of a dwelling is there. The issue of what Jamaica calls your yard, because if you look at the Jamaica regulations, you'll see that they said including the yard, and we all know the term yardie, etc. The yard is a interesting concept. In Trinidad and Tobago, your private property is often defined by your boundaries and your positions. The reason that we didn't go into the full extent of the precincts of the property, etc., is that that is a matter for the Trinidad and Tobago police, which can easily be interpreted. This is not an opportunity for smartmanism or smart womanism, where people come into the dance and basically try to give you all of the technical reasons why the law does not apply to you. The combination of the regulations, not only in Regulation 4, but the rest of the regulations basically say that those who are engaged in law enforcement can come about and ask you to disperse, ask you to return to your home. They may charge you for an offense, because at the end of the day, the reasonableness of the law enforcement is going to be in question. That's why I was very careful in my submissions a while ago to remind that the lawful instructions of the TTDF and the lawful instructions of the Trinidad and Tobago Police Service are on deck. But I say quite simply to our listening public, let's avoid technicalities. They're necessary, but let's avoid them in the context of being a smart man or a smart woman. Specifically, in answer to your question as to the orders, the Constitution is extremely clear, and precedent is also with us, that the hours of adjustment of curfew and curfew times are traditionally done by the Commissioner of Police, where those are gazetted and curfew hours may be adjusted. And that's an easy way so that you can preserve the regulations in existence without having to create a new one. You can carve out the times for adjustment for curfew. That is done by way of order of the Commissioner of Police. The Constitution specifically allows for that to be in existence, that the President will see that regulations are made or that orders can be done, and therefore the delegation of that has happened in 2011, in 2008, in 1990, in 1970. All of these hours of operation, hours of curfew were delegated to the order of the Commissioner of Police.
Thank you. We now go quickly to the Newsday. Newsday, we are ready for your questions.
She's muted.
Hi, good day. Paula Lindo here from the Newsday. I wanted to ask two questions to the Minister of Health. The first is, what is being done to address concerns of manpower shortages at the different regional health authorities? And when will the second round of vaccination start with the AstraZeneca vaccine? Thank you.
Thank you very much, Paula. So what we are doing to address manpower shortages, and thank you for that question, we are doing several things. Rationalization of staff, bringing on more staff. We are being very selective with elective surgeries, where we are doing basically emergency elective surgeries that frees up some staff. Also, as I indicated, outpatient clinics will be scaled down, but we are not leaving our patients in the lurch without treatment. What we are doing with outpatient clinics, as we did last year, is that we are moving more towards telemedicine instead of face-to-face interaction between a doctor and a patient, and automatic refills of prescriptions. So the diabetic, the hypertensive will still be maintained on their medication, and their health status should not be adversely affected. When we do those things, it frees up a lot of persons to go into the hospital system to take care of the very ill. The second part of your question, when will the AstraZeneca second dose start? So let's go back in time. We started the AstraZeneca program on Tuesday, April the 6th. Yes. And the interval for the second dose of AstraZeneca is 8 to 12 weeks. Therefore, to meet that time frame, according to WHO, 8 weeks from April the 6th will be June the 6th. So we actually start the second dose in June the 6th. And that is why I said at the start, it is so unfortunate where persons are saying we have stopped the program. We had to wind down dose 1 so that we kept back enough shots for dose 2. So those persons who received their first, those 60,000 persons are guaranteed their second dose of AstraZeneca. So it starts on June the 6th. Thank you very much.
And thank you, Minister. ACP, we are ready for your questions.
Hi, good morning, Prime Harry, ACP. Minister of Health, I wanted to start with you just to talk about the vaccine. Do you have an idea? The COVAX 2, can you tell us when those would expire? And now, do you have an idea of the exact numbers that would get their first dose in terms of the overage? And my second question is for the Attorney General. Good morning, Ms. AG. I want to deal with Regulation 8.1 of the SOE regulations, which state that a police officer can arrest without warrant anyone he reasonably suspects has acted or is acting or is about to act in a manner that is prejudicial to public health, public safety, or public order. My question is, does that give our officers too much power that he can go into someone's property and say, and he can arrest that person who he suspects is about to act in a manner that is contrary to public law? Can you just give us some clarity on that? And because people seem to be a bit concerned about how police could enter into private property along those lines. Thank you.
Thank you very much, Prior, for your question. So I'll give you more information than you asked for. So we are starting the second round of AstraZeneca vaccines on June the 6th. We have to finish that within about a 4-week period. So June the 6th to early July. The expiry date of the second tranche of COVAX vaccines, which we received on May the 10th, expires on August 31st. So we are going to be well within the expiry date. That was 33,600 doses. The other doses to take you up to 60,000 will come from the 40,000 doses we got from SII, which was the gift that we got from India, with many thanks, after the Honorable Prime Minister wrote to his counterpart. That expires on July 18th. So obviously, we'll be using the SII doses first and the COVAX doses second. So we are well within the parameters of the expiry date to guarantee those 60,000 persons who got their first dose of AstraZeneca to now get their 60,000 second shot to take them up to full immunity. Thank you very much, Prior. Excellent question.
Thank you very much. We now go to...
Yes,
Oh, sorry.
Yeah. Thank you very much. In answer to the question posed on Regulation 8, Regulation 8 is described as the power of arrest. Regulation 8 says, notwithstanding any law to the contrary, a police officer may arrest without warrant any person whom he reasonably suspects has acted or is acting or is about to act in a manner prejudicial to public health, public safety, or public order, or to have committed or is committing or is about to commit an offense against these regulations, and that he may take such steps and use such force as appear to him necessary. First of all, this is a power that is in every version of regulations under the state of emergency. This is also reflective of the laws of the Republic of Trinidad and Tobago. It is a very important thing to focus upon the use of the word reasonably alongside suspects. So the Trinidad and Tobago Police or the TTDF, if they are providing the assistance, they must reasonably suspect. That reasonable suspicion is the standard of law that we're well accustomed to. In fact, in the previous versions of states of emergency, this concept of reasonable suspicion wasn't set out that way. We were careful to put it that way. I want to remind that even though we are under a state of emergency and the suspension of rights is arguable, that does not mean that the laws of the Republic of Trinidad and Tobago stop. There are remedies and their rights of redress to every citizen. You will note in this law that we are preserving the jurisdiction of the court in every way possible. There's no restriction on bail. There's no restriction against habeas corpus. That is the right to be brought to court and say, well, tell me why I'm being imprisoned. That is not in these laws, in these regulations, even though they were in every other regulation that we had a look at, including the 2011 regulations. This is what I mean about the government taking its time to balance the rights of the citizens. And this is why I have urged the editors of the Express to avoid the kind of headline that they have, most respectfully, because we've got to get this thing right. So there is redress to the citizens of the Republic of Trinidad and Tobago. The courts are fully with jurisdiction. There is nothing to stop an allegation of malicious prosecution or false imprisonment, or the fact that the police officer is wrong in the reasonable suspicion, or for even the rights under the Constitution in Section 14 or under judicial review. So this is a very careful balance of the laws of the Republic of Trinidad and Tobago. Again, in this particular instance of state of emergency, this enemy is not the traditional kind that can be cordoned off by a barrier along a road in Trinidad and Tobago. This is an enemy that is unseen, and the pandemic is a different form of management.
Thank you very much, AG. We quickly go to TV6.
Good afternoon, everyone. Urvashi from TV6. Mr. Alexander, just a quick request, noting that the question and answer period started at 10:52. I trust that all my colleagues will get an opportunity to pose their questions. I have an outstanding question from last week where I asked Dr. Hines for a breakdown on the deaths where they occurred, if they occurred at home as opposed to hospital. So that's an outstanding question from last week. Dr. Parasram, good to see you here. Given that ICUs are at capacity and the case fatality rate appears to be increasing, are more people dying because of this new Brazilian strain, or are they dying because they cannot access the adequate medical attention? My second question, I've been informed of an outbreak at Ward 9 at the St. Anne's Hospital, where, you can correct me if I'm wrong, I'm being told 22 out of 25 patients and staff have tested positive. Has the parallel healthcare system collapsed, or is it nearing collapse? Thank you.
Thank you very much. Dr. Parashram, will you take the first question?
Sure. So at the end of the day, what I had said, I think there was an article over the weekend discussing the P1 and its role in terms of the deaths in the country. So far, we have 40 cases of P1 confirmed in the country. None of them have been attributed or related to any of the deaths that we have gotten. What we see is the general trend, and Dr. Hines would have gone through the trends in terms of the age groups of those persons affected by COVID-19 that would have had mortality. More or less, the trends remain similar. A slight decrease in the amount in the higher age groups, and you're seeing some in the 50s and the 40s. When I say slight, it's about 5%. So there's no great change in that regard. We are seeing a slight increase as well in the female to male ratio, where for the most of the pandemic you would have had females, for example, accounting for 25%, males accounting for 75%. That has skewed a little bit, with the females accounting for a little higher percent, close to 30, between 30 and 35, depending on which area you look at. In terms of the ICUs and HDUs, as Dr. Richards would have indicated a few days subsequently, in the Couva Hospital we have reached capacity. We are in the process of actually getting ICUs set up at the Point Fortin Hospital, where we have some ventilators being set up. There's ICUs in Arima as well. And with the field hospitals will be coming on stream hopefully by Wednesday, there's further ICU and HDU capacity in those facilities. So we have not reached full capacity as yet, but again, it depends on how the cases go, the influx of people into the system, and of course the severity of the disease will lend itself to how quickly we fill those spaces up. And again, the call is really to the public to continue the public health measures. The quicker we can get the total numbers down, the proportion of those people needing hospitalization, will of course decrease as well. Dr. Richards will give an update, I think, on the St. Anne's issue.
Okay, good morning, Urvashi. Two very good questions directed to Dr. Parashram and myself. Thank you. I'd just like to add that while we report that the ICU capacity is at its maximum at the Couva Hospital and at the Arima General and Augustus Long Hospital, the Ministry of Health does have additional resources such as ventilators, which we are using to incrementally and on a phase basis increase the capacity. However, these resources are of course limited and will run out if we continue at this trend. So I would like to reiterate that also, although the parallel healthcare system is at a 73% level overall in Trinidad and Tobago in terms of the hospitals, I would not say that it's collapsed, but it is very close to being overwhelmed, and its resilience is being tested. What I'd say is that we work on a touch and go situation. The second question was centered around the St. Anne's Hospital, and yes, I can confirm that there are 20 confirmed cases of patients at Ward 9, but those patients are being isolated and managed in a similar manner to persons who receive treatment, for example, at the Couva Medical and Multi-Training Facility. If they deteriorate or decompensate and require a higher level of care, the normal Ministry of Health protocols will be applied. Thank you very much for your two questions.
Thank you very much, Dr. Richards. We go to I-95.5.
Good afternoon to everyone. Whitfield Turner from I-95.5. Minister, I believe I can ask you these two questions from where you sit. Are there any plans to boost the capacity at the Scarborough lab to be able to cut back on the turnaround time between swabbing and persons receiving their results? And secondly, it has come to my attention, I've actually had sight of a flyer where a certain company is advertising their services where they will come to people's home and swab them for COVID, and they'll be using the rapid testing method. However, one person who actually asked them whether those results, if positive, would be sent to the Ministry of Health, they were told that no, those results won't go to the Ministry of Health. So is the ministry aware of this? Is rapid testing now part of the testing mechanisms in the country? And what is the potential that positives may be outside, which will not be captured by the Ministry of Health systems? Thank you.
Thank you very much, Mr. Turner. So I will take the first question, and the Chief Medical Officer will take the second question about rapid testing. So the question about boosting capacity at the Scarborough Hospital under the THA Act falls squarely within the responsibility of the TRHA. I don't have that responsibility. My responsibility for those operational issues lie within the 4 RHAs in Trinidad. So it's a good question, but I do respectfully submit that you pose it to the officials at the TRHA. And I'll hand you over now to the CMO to answer the other part of the question.
Okay, thanks, Mr. Turner. So we have been notified from time to time of various labs offering testing, whether it be rapid or otherwise. And I'm glad that the AG is here. I think the law speaks to the fact that if you have a positive test, you need to report it to the office of the CMO. And we take the, what it is, a rapid or a PCR test that you're doing, you should, under the law, report it. And of course, there are penalties that can be applied. So just to remind everyone, and Mr. Turner, if you have a specific example you want to pass to the Ministry of Health, and we have been reaching out to individual labs in actually writing to them, calling them, reminding them of that obligation under the law. So if you have a particular lab of concern, please alert us to it, and we will have a similar process with that particular lab.
I'll also hand you over to...
Thank you very much. Just to jump in on the invitation of the CMO a moment ago, I want to remind what I said a little while ago. The public health regulations are in effect. Legal notice number 143 of 2021 specifically says at regulation 8 that effectively in subsection 2, where a private medical laboratory, medical practitioner, or person fails to report and forward results to the CMO and an RHA in accordance with subregulation 1, the owner or operator of the private medical laboratory, medical practitioner, or the person, as the case may be, commits an offense and is liable on summary conviction to a fine of $250,000 and to imprisonment for 6 months. Let me just quite simply say, if any evidence of this sort of behavior is in effect, there is a civic and important duty upon all of us to report these circumstances. This is criminal conduct, and it must be met with precision, because it is fake news, poor management, and scandal that will effectively be the end of all of us. And I just want to urge reporters, honorable members of the media, let's be careful with the language that we use. Let's be careful about the sensationalism. At the same point in time, let's be very serious about what we're doing and comply with the laws of the Republic of Trinidad and Tobago. So if you have the evidence of who is reported to have done this, let's act upon it. There is anonymity in reporting, and let's deal with the heart of this issue.
Thank you very much, AG. We quickly go to Guardian Media.
Hi, good morning, everyone. It's Renuka Singh at the Trinidad Guardian. My first question is for the CMO. Dr. Parashuram, at the beginning of the month, you said that back in March, in the early part of March, you noticed a considerable increase and that people at the time thought that it was too small, but you thought there was enough cause for concern and that there would be a snowball effect. Are we in the midst of that snowball effect that your projections would have shown back in March? And could you give us an idea of what was the rationale that opposed yours at that time? My second question is for the Minister of Health. We know that the 80 beds donated by the US government has HDU and ICU capabilities, but does that mean that it comes with the requisite ventilators or medical accoutrements, or is that something that the local health sector has to provide? Thank you.
Okay, so yeah, just to go back over what myself and even Dr. Hines would have indicated, we would have seen a gradual increase in number of cases beginning in early March, when we would have had a rolling daily 7-day average of about 3. I think that quickly went up from 3 to 10, and then of course 10 to 15. And we looked at it as a small increase nationwide. People said, 15 cases a day is not something alarming. And really looking at it from an epidemiological perspective, and what Dr. Hines has shown in his graphs is the way it doubles. So 10 will quickly go to 100. And that is our concern. And we voice that concern to the population in general, to try to start the beginnings of people having a behavior that they would have had for the best part of November to March of 2021, November 2020, to really try to get persons back on track and have that type of behavior to get those figures of 10 or 15 a day back down to 3 or 4, which would have put us in a good position. So really that was what I was alluding to at that point in time. Again, we put public health measures in place. But what happens in terms of this particular epidemic is when you have movement of people, you have congregation, you don't see the effect of that for 2 to 3 weeks after the event has already occurred. And what happens after that, when you see the actual spike that you're looking at, it is usually manifested based on activities that has passed. The die is usually cast. You put in your interventions at that point, and again, it takes 2 to 3 weeks for that particular intervention to kick in, and you have a period of abeyance in between where the numbers continue to rise. In terms of where we are at now, we are hoping that we are at the peak of this phase 3, and that within the coming days or weeks, we begin to see a slowing of the rise, hopefully a plateauing, decreased number of cases coming to the hospital, and eventually, with all the measures culminating in the SOE, that we really see begin to see a decrease towards normalcy. Yeah, I think more or less that gives you a summary of what it is at. In terms of the field hospitals, the they come with some of the ICU HDU supportive elements in terms of equipment, but certain parts of it has to be brought in, which is available in country, and moved to site. So for Northwest, for example, that is being done, and hopefully that should be completed latest on Wednesday morning, and they will be equipped with a few additional beds, not a large amount in terms of ICU and HDU, to add to our overall grid.
I thank you very much, CMO. We go now to TTT.
This question is for the AG, Mahalia Joseph, TTT News. I know you did clarify that there will be no outdoor exercising and whatnot, but would there be any exemptions for those training for the Olympics?
Thank you. So, under the previous regulations, we did exempt persons training for national teams. So, persons training for Olympics, CONCACAF, that goes on. So, the national teams which were already exempted, that will still apply. Okay? Thank you very much, Mahalia. Sure.
If I can point you specifically, thank you, my learned colleague. Clearly, he's well schooled in law as well. Let's look at the regulations. So if you look to regulations under the SOE, you will see at regulation 3, we start off with during the period of the public emergency, etc., a person shall not, and we deal with sport, we deal with group sports, team sports, or other particular types of sports, and there is a huge caveat there that says except where authorized by the minister. Something I'd like to point out again. The minister is still the Minister of Health, even though we're under the state of emergency regulations, where the minister is normally the Minister of National Security, because this is a public pandemic health issue. We have the Minister of Health in the driver's seat because all of the protocols and structures have already been put in place in the Ministry of Health under the public health regulations, and therefore we are improving the reach of the Minister of Health and the team to treat with this. Just the final point I'd like to say on the issue of exercise is, again, to remind, because we're dealing with a culture, our culture, that is hard to manage in the ingenious ways in which people seek to find exceptions to themselves. Unfortunately, in this circumstance, running, walking, hiking, exercising, all had to be managed with one blanket approval. This is a very ingenious society. I note all of the wonderful musical clips dealing with the Prime Minister's reference to a Calypso song and how instantaneously they were put out. So we're ingenious. Let's just continue to be ingenious in trying to fight the pandemic. I just want to jump on to what the CMO said. This is doable. It's just a matter of making sure that we bring our behavior back into line, very conscious of COVID fatigue and how difficult that can be with people just being tired. But if we take a concerted effort to work together, we can definitely see this thing come to an end. Thank you.
As we wrap up today, I would like to thank our panelists for providing us with their updates, the media for their engaging questions, and you, our listeners and viewers. Thank you for sharing your time with us today. And goodbye for now.
A lot of we can